Well, what other copy would it be?
Okay, good afternoon, everyone, and thanks for joining our briefing on the City of Philadelphia's response to COVID-19. Today, the speakers again are joining virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thank you, Mike. Good afternoon, everyone. As most of you have already heard by now, Temple University made the announcement this morning that it will keep most classes online for the fall semester. I want to thank Temple President Richard Englert and his team for what I know was a very difficult decision. I also want to thank the students, families, staff, and faculty for their patience and diligence over the past several weeks. It's important to remember that when this pandemic first appeared in Philadelphia, Temple stepped up in a big way, big time. They made the Leo Corr Center available to the city, charged for a surge facility. Staff and leadership of the Temple University system have also been invaluable partners, both in standing up that facility and in working with our health department to mitigate the spread of the virus within the community. Temple is a shining jewel in our city, and I hope all Philadelphians will support the university and their students as they work through this period. Earlier this week, we launched our Eviction Diversion Program, which enables landlords and tenants to work out agreements without having to go to court. As of September 1st, the program is required for all landlords with tenants in the city of Philadelphia who have had difficulty paying rent due to the COVID-19 related hardship. With this program, landlords must participate in a mediation meeting before taking other steps to evict. Mediation helps tenants avoid an eviction while also helping landlords avoid vacancies and unit turnover costs. To schedule a mediation, landlords must first submit a request through the web portal, phlevictiondiversion.org. That's phlevictiondiversion.org. Once it is confirmed that the request is complete, the landlord and tenant will be scheduled for a mediation conference within 30 days. Today, I also want to bring to your attention the latest order issued by the CDC, which will provide relief to many Philadelphians who may face eviction. The CDC order bans evictions for non-payment of rent for certain qualified tenants. The order does not relieve tenants of paying rent, but helps them stay in their homes through the end of the year because of the COVID-19 pandemic. This order is expected to become effective on Friday, September 4th, 2020. More information on the impact of the CDC order will become available in the coming days, so please stay tuned for updates. Finally, even though the holidays look different this year due to COVID-19, the Labor Day weekend has always been the unofficial end of summer. Unfortunately, it has also been linked to more high or drunk driver deaths drunk drivers on our roads. I know many of you are making plans for the long weekend. Today, we are here to remind you to celebrate safely. That means avoiding gatherings, wearing a mask when you are around folks who do not live in your household, and driving sober. Traffic crashes are a serious public health threat to Philadelphians, and impaired driving is one of the major causes. Between 2014 and 2018, 174 people were killed or seriously injured on Philadelphia streets in impaired driver-related crashes. The city's Vision Zero Task Force remains committed to reducing these numbers to zero. One life lost is one life too many. To help save lives during the long holiday weekend, our police are teaming up with the Highway Traffic Safety Administration to crack down on drivers under the influence. The decision to drive sober should never be a tough one. Impaired driving of all types is illegal and can be deadly to the driver, the passengers, and to other people using the road. Law enforcement will be out on high alert, working hard to protect the community. There will be zero tolerance for anyone driving buzzed, high, or drunk. Doesn't matter what term you use. If you are feeling a little high, buzzed, stoned, wasted, or drunk, then you are impaired and should not get behind a wheel. Stay home or drive sober this Labor Day and every day. For more information, visit visitzerophl.com. Again, that's visionzerophl.com. And now I turn it over to Dr. Farley for his update.
Thank you very much, Mayor. We are seeing an increase in the coronavirus case counts in the past couple of days. Here are the numbers. Since this time yesterday, we've identified 166 new cases in Philadelphia residents, bringing us to a total of 34,310 since the beginning of the epidemic. Now, this is the second day in a row which we've seen high case counts. Yesterday, we identified 235 new cases. Some of those are people who were tested last week and are just now being identified as Philadelphia residents. And so last week, the week that ended on August 28th, we're now up to an average of 108 cases per day. On Tuesday, I said that we were around in the 90s per day, so we've gone above 100. And the percent positive last week was now 4.1%. Now, this increase we've seen over the past few days has predominantly been in younger people. Today, 31% of the new cases are ages 20 to 29, and 25% are ages 10 to 19, most of those probably in the high teenage age range. We don't have a complete accounting of the cases that are associated with the outbreak at Temple University because students may not report or their Philadelphia addresses. They may report their address where their parents live, in which case we don't get the report here as a Philadelphia resident. And if students are tested at community sites, those community sites may not know that they're Temple students, so that information may not go to Temple. However, it does appear that most of the increase in the past week that we've seen across the city is related to the outbreak at Temple University. Now, this is occurring in the context where there's a rise in cases in the state of Pennsylvania as a whole, and rises we've seen in many other states across the country. Much of these appear to be linked to college outbreaks. Since this time yesterday, we've identified one new death of the coronavirus infection in a Philadelphia resident. The total is now 1,759 for deaths since the beginning of the epidemic. A quick update on contact tracing. For the contact tracing we did last week, we were able to reach and have agreed to participate 60% of the cases that we managed. 8% had no telephone, 24% we've been unable to reach, so we still have a problem with a number of people who are not picking up the phone, and 3% talked to us but refused to participate. Of the contacts that we had named for us, 77% were reached and they agreed to participate. Now let me talk a little bit more about the situation at Temple. Our contact tracing continues to show that the cases were predominantly among students who lived off campus. And the spread was occurring amongst roommates, often in crowded apartment buildings, and in social gatherings, typically small social gatherings. And we continue to work closely with Temple University to contain that outbreak with expanded testing and with contact tracing. I remind people that in the short term, our guidance to Temple students is to be very careful, just to work under the assumption that everyone around you is infected because many people have this infection and show no symptoms, and that you should stay in your room or your apartment unless you have to go out for an essential errand. And when you're around anyone else, wear a mask. Now, over the longer term, as you heard this morning and you heard the mayor just talk about, Temple has announced that it will shift almost all of its classes online for the remainder of the semester. That will enable students to take classes from anywhere. And Temple is offering a refund for room and board for students who are living in the dormitories to enable students who want to vacate student housing. But Temple will maintain a quarantine and isolation space on campus. Now, we are today encouraging students who live off campus in these crowded apartments, if they can, to move back to where they lived over the summer, to reduce the density there, to reduce the risk there. This will reduce the risk to those students as well as to others across the city. We recommend that students do that, however, carefully to avoid bringing the infection back to their family members. Health department will be working with Temple on guidance to students as to what's the best way to do that. In the meantime, testing is available through Temple University or any student, like anyone else, can go to our website, www.phila.gov/testing, and access any of the testing sites that are listed there. As the mayor did, though, I want to go out of my way to really thank Temple for working so closely with the health department leading up to the start of the semester and as well during the response to this outbreak. Temple did everything we asked them to do in advance, and they were very successful in preventing spread in classrooms, in dormitories, and in cafeterias, all the things that happen on campus. What occurred here really was the things were very much out of their control and students living off campus. The Temple did, however, call us last week when they first noticed an increase in cases. They worked closely with us over the weekend during this week to try to contain this. This is simply not an easy problem to fix. I do think that the plan that the university's put together is the wisest plan to respond over the longer term. I also want to remind people, as the mayor did, the Temple stepped up to help the city in April by lending the Leah Core Center for our surge facility, which was absolutely necessary at that time. So we appreciate that, as well as we appreciate how quickly they responded to this stage as well. So that's the situation at Temple. Overall, we have not changed our plans to allow indoor dining in theaters to reopen with restrictions next Tuesday, September 8th. In the big picture, the college-associated outbreaks, though, do show that virus still has the potential to come back strong. And I continue to get many requests to allow additional activities to restart. And I know it's difficult for people to maintain these safety precautions, especially after so many months. But we need to continue to limit how we get together to avoid more cases. And although most people recover fine, just remind people that some people get very seriously ill and some infections can be fatal. So even for those of you who are young and are likely to recover well, you may pass the infection on to others, so you don't want to get that infection and pass it on to somebody who may be medically vulnerable. Our recommendations to everyone citywide is to avoid social gatherings, including small gatherings with relatives or friends, the sort of people you see every day that you may trust. Avoid those gatherings. That's how the predominant mechanism for this virus to spread right now. And when you need to be around others, make sure you wear a mask, including a mask when you're around relatives and friends. This is especially important for people over the age of 65 or people with medical conditions or anyone near those who are over 65 with medical conditions. That's the status report for today. If you want more information, go to our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we turn it over to Armando for the Spanish language translations and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el jueves 3 de septiembre del 2020. Buenas tardes. Como ustedes ya habrán oído, la Universidad de Temple anunció esta mañana que la mayoría de las clases durante el semestre del otoño se dictarán en línea. Quiero agradecerle al presidente de Temple, Richard Englert, y a su equipo por lo que sé que ha sido una decisión muy difícil de tomar. También quiero agradecerles a los estudiantes, a sus familias, al personal y a los profesores por su paciencia y diligencia durante las últimas semanas. Es importante recordar que cuando esta pandemia apareció por primera vez en Filadelfia, Temple dio un paso adelante apoyando a nuestra ciudad. Pusieron el Centro Liacuras a disposición de la ciudad sin cargo alguno para la instalación de un hospital de campaña. El personal y el liderazgo del sistema de salud de la Universidad de Temple también han sido aliados y socios invaluables, tanto en el mantenimiento de esta instalación como en el trabajo con nuestro Departamento de Salud para mitigar la propagación del virus en la comunidad. Temple es una valiosa joya para nuestra ciudad y espero que todos los habitantes de Filadelfia apoyen a la universidad y a sus estudiantes durante este periodo. A principios de esta semana lanzamos nuestro programa de prevención de desalojo, que les permite a los propietarios e inquilinos llegar a acuerdos sin tener que acudir a los tribunales. A partir del 1 de septiembre, este programa es obligatorio para todos los propietarios en la ciudad de Filadelfia cuyos inquilinos hayan tenido dificultades con el pago del alquiler debido al COVID-19. Con este programa, los propietarios deben participar en una reunión de mediación antes de tomar otras medidas previas a un desalojo. La mediación ayuda a los inquilinos a evitarlo y también les ayuda a los propietarios a evitar las vacancias y los costos de rotar inquilinos. Para programar una mediación, los propietarios deben primero enviar una solicitud a través del portal web Eviction-Diversion.org. Una vez que se confirme que la solicitud está completa, el propietario y el inquilino se reunirán en una conferencia de mediación dentro de los siguientes 30 días. Hoy también quiero llamar su atención sobre la última orden emitida por los Centros de Control de Enfermedades que brindará alivio a muchos habitantes de Filadelfia que pueden estar enfrentando un desalojo. La orden de los Centros de Control de Enfermedades prohíbe los desalojos por falta de pago de alquiler para ciertos inquilinos calificados. La orden no excusa a los inquilinos de pagar el alquiler, pero les ayuda a permanecer en sus hogares hasta fin de año debido a la pandemia del COVID-19. Se espera que esta orden entre en vigencia el viernes 4 de septiembre del 2020. Para mayor información sobre el impacto de esta orden de los Centros de Control de Enfermedades, vean su sitio web porque esta información estará disponible en los próximos días. Finalmente, aunque las vacaciones lucen diferentes este año debido al COVID-19, el fin de semana del Día del Trabajo tradicionalmente ha sido el fin extraoficial del verano. Desafortunadamente, también se ha relacionado con más conductores drogados o ebrios en nuestras carreteras. Sé que muchos de ustedes están haciendo planes para el fin de semana largo. Hoy estamos aquí para recordarle que hay que celebrar de forma segura. Esto significa evitar las reuniones sociales, usar una mascarilla cuando esté cerca de personas que no viven en su hogar y, por favor, el conducir sobrios. Los accidentes de tráfico son una seria amenaza para la salud pública de los habitantes de Filadelfia y el manejar en estado de ebriedad es una de las principales causas. Entre 2014 y el 2018, 174 personas murieron o resultaron gravemente heridas en las calles de Filadelfia en accidentes relacionados con conductores ebrios. Un grupo de trabajo de Vision Zero de la ciudad sigue comprometido a reducir estos números a cero porque una sola muerte que se dé es demasiado. Para ayudar a salvar vidas durante el largo fin de semana festivo, nuestra policía se está asociando con la Administración Nacional de Seguridad del Tráfico en las Carreteras para tomar medidas enérgicas contra los conductores que estén bajo la influencia del alcohol o las drogas. La decisión de conducir sobrio nunca puede ser difícil. Manejar en estado de ebriedad o bajo los efectos de las drogas de cualquier tipo es ilegal y puede ser mortal para el conductor, los pasajeros y para otras personas. Las fuerzas del orden estarán en alerta máxima trabajando arduamente para proteger a la comunidad. No habrá ninguna tolerancia para cualquier persona que conduzca borracho o drogado. No importa qué término utilices, si te sientes un poco drogado, ebrio, prendido o borracho, entonces no debes ponerte tras el volante. Por favor, quédate en casa o conduce sobrio este día del trabajo y todos los días de tu vida. Para obtener mayor información, visite visionzerophl.com. Y esta es la actualización en materia de salud para el día 3 de septiembre del 2020. Ha habido un aumento en el número de casos relacionados con el brote en la Universidad de Temple. El día de hoy reportamos 166 nuevos casos, con un total de 34.310 casos reportados en total. Este es el segundo día seguido con un conteo alto de casos. Ayer tuvimos 235 casos. Algunas personas se realizaron la prueba la semana pasada y fueron identificadas como residentes de Filadelfia. El promedio de casos identificados pertenecientes a Filadelfia es de 10 diarios para la semana que acabó el 28 de agosto. El aumento entre los casos ha sido predominantemente en las personas jóvenes. No tenemos un conteo completo de los casos asociados con Temple, pero en los últimos 3 días, el 31% de los casos corresponden a personas entre 20 y 29 años de edad y un 25% entre los jóvenes de 10 y 20 años. Los estudiantes pueden no reportar sus direcciones en Filadelfia y si las pruebas se realizaron en un centro comunitario, no podremos saber todavía si son estudiantes de Temple. Pero este aumento parece estar relacionado con el inicio de clases en las universidades. Los casos están aumentando en Pensilvania y en los otros estados en los Estados Unidos en los últimos días. Pareciera estar relacionado también ahí con el inicio de clases en las universidades. El día de hoy reportamos una muerte por el COVID-19. En total, 1.759 personas han fallecido en Filadelfia a consecuencia de este virus. Estamos recibiendo esta información por grupos, por lo que esperamos anunciar más fallecimientos esta semana. Ahora bien, sobre el brote del COVID-19 en la Universidad de Temple, esto es lo que podemos compartir con ustedes. El rastreo de contactos muestra casos que se encuentran principalmente fuera del campus, entre compañeros de cuarto y como producto de reuniones sociales. Continuaremos trabajando con la Universidad de Temple para contener este brote. Estamos expandiendo la capacidad de realizar pruebas y el rastreo de contactos. Cualquier estudiante de Temple que esté escuchando, por favor, sigue estas recomendaciones. Supón que todos los que te rodean ya están infectados. Debes permanecer en tu habitación o en tu apartamento, excepto para realizar actividades esenciales. Utiliza una mascarilla alrededor de cualquier otra persona. A largo plazo, las medidas ya fueron anunciadas esta mañana. Temple ha pasado a la modalidad virtual para sus clases para el resto del año. Esto permitirá que los estudiantes tomen clases desde cualquier lugar. Temple también está ofreciendo reembolsar el dinero que han pagado por hospedaje a los estudiantes, para luego permitir de que estos lugares sean desocupados. Se va a mantener la cuarentena y el aislamiento en el campus. Les pedimos a los estudiantes que viven fuera del campus que se muden a un lugar donde vivieron durante el verano. Esto es para reducir el riesgo para ellos y para otros. Y esto debe hacerse cuidadosamente para no llevar la infección a sus familias. El Departamento de Salud trabajará con Temple para proporcionarles orientación y pruebas a los estudiantes que vuelvan a casa. Mientras tanto, los estudiantes pueden realizarse la prueba en la Universidad de Temple o buscar un centro de pruebas en phila.gov/testing. Gracias a la Universidad de Temple por trabajar de forma cercana y tan rápida con el Departamento de Salud. Nos llamaron la semana pasada cuando el brote fue identificado. Trabajamos directamente con ellos durante el fin de semana y esta semana. Ellos han tomado la decisión más sabia y los resultados se verán a largo plazo. La Universidad de Temple puso a disposición nuestra el Acura Center y allí pudimos instalar un hospital de campaña. Por lo tanto, apreciamos su rápida respuesta con esta situación. Sobre el rastreo de contactos para la semana finalizada el 28 de agosto, el 60% de los contactados por teléfono accedieron a participar. Un 8% no tenía el número telefónico asociado para poder ser contactados. Un 24% fue imposible contactarlos. El 3% se rehusó a participar, el otro 3% no comprendió el propósito de nuestra llamada, y de los contactos mencionados, el 77% fue contactado y accedieron a observar la cuarentena. No han cambiado nuestros planes para permitir que los cines y el servicio en el interior de restaurantes se reanuden con restricciones a partir del martes 8 de septiembre. Los brotes asociados a la universidad nos muestran que el virus puede volver con fuerza. Por lo tanto, hemos recibido muchas solicitudes para permitir que se reinicien actividades adicionales. Sabemos que es difícil mantener las precauciones y las normas de seguridad, pero debemos seguir limitando la forma en la cual nos reunimos para evitar más casos. Aunque la mayoría de las personas se recuperan bien, algunas enferman gravemente y algunas infecciones son fatales. Incluso si una persona se recupera bien, puede todavía transmitir la infección a otra persona especialmente vulnerable. Por lo tanto, por favor, evite asistir a reuniones sociales. Utilice la mascarilla cuando esté cerca de otras personas, incluyendo familiares y amigos. Y esto es especialmente importante para las personas mayores de 65 años de edad o con condiciones médicas crónicas. Juntos le podemos ganar al COVID-19, así que por favor, utilice su mascarilla. Muchas gracias.
All right, thank you, Armando. And we're now going to move to the Q&A portion for members of the press. Thank you for joining the briefing on topics related to the COVID-19 pandemic. Also joining us today is First Deputy Managing Director Tumar Alexander. The first round of questions is limited to COVID-19, including the matters related to eviction and the city's Eviction Diversion Program. Joining us for questions on that topic are Deputy Managing Director Eva Gladstein for Health and Human Services and Joe Rosenberger Altman, Senior Attorney in the Philadelphia Law Department. If you have questions on any other topics, please hold them for the second round. And if your hand is raised now and your question is not on COVID-19 or the eviction issue, please lower it and we will announce the second round when we get to it. And thank you again for joining us. One representative media outlet, again, is permitted to ask questions, and reporters must limit their questions to 3 or fewer. And with that, let's go first to Layla Jones of the.
Hi, I have 2 questions for Dr. Farley. My first is, Dr. Farley, do you think that Center City Restaurant Week is a good idea so close with the rollout of indoor dining?
I'm not familiar with the details of Center City Restaurant Week. I would simply say that we have a lot of safety precautions built into the indoor dining rules, and that if all the restaurants follow them, the risk should be low.
And could I pitch that same question to you too, Mayor Kenney?
Well, I mean, if the capacities are the same as they are in the requirements for indoor dining, and all the protocols are followed, it should be safe, as safe as possible. And the fact that it's Restaurant Week's not going to make it available to put more people than the percentage allowed in the indoor dining space. So the designation of that week, I don't think makes any affects in any way the things we're putting in place to allow for indoor dining.
Layla, are you all set? Okay, I think you're good. Let us go now to David Melandra of the Philly Sports Network. David, are you there? All right, David, if you can't unmute yourself, we'll put you on hold there. And let's try now to Lauren Make of NBC 10. Lauren, you're
Hey,
on.
everybody. Hey, everyone. Can you hear me okay?
Yes.
Okay, excellent. I'm also going to request from my colleagues at Telemundo, they would like this translated if possible, whether that's now or later on, if you, I don't know when you do it.
We can do it now. Armando, if you can help out with that. Thank you.
Okay, great. Thank you so much. My question is about the COVID-19 vaccine. We're getting some information that the CDC is telling Philadelphia and other places to prepare for a potential vaccine as early as early November. And I wanted to ask Dr. Farley, are you comfortable with the process so far? And do you have any concerns about how it's being handled or the speed of it?
Well, what we've been asked to...
You wanna do Spanish first?
Tenemos nosotros una pregunta para el comisionado Farley con respecto a la vacuna del COVID-19. Hay información de los Centros de Control de Enfermedades que nos indica que Filadelfia y otras ciudades están preparándose para recibir la vacuna tan temprano como principios de noviembre. Queremos saber cuán cómodo se siente el comisionado Farley con el proceso hasta ahora y si tiene alguna preocupación de cómo se va a manejar esto. Go ahead.
So what we've been asked by the CDC is to assume that a vaccine is available. And if that were the case, how would we distribute the vaccine to people who are at high risk or who are designated as high priority? And I don't think that that's inappropriate at all. I think that's appropriate for us to develop those plans. Sooner or later, we're going to have to disseminate a vaccine. I think the deeper question is, will there be vaccine that is approved that we are confident is safe? And we don't know that yet. We don't know what vaccine they're talking about for sure. And we haven't seen any data about the safety or effectiveness of these vaccines. And so we'll have to address that question closer when we hear if there's any vaccine licensed for distribution.
And how will that work? Once the CDC says, okay, this vaccine is okay, whether they're saying it's gone through the phase 3 trials or they're saying we're using an emergency use authorization for it, will the city just distribute it, or will you first make a determination of whether you think it's safe?
Well, I think it may be
Armando.
more a question of,
El Centro de Control de Enfermedades lo que nos ha pedido ha sido asumir cómo podríamos hacer el proceso de distribución de una vacuna una vez que esté disponible y cómo se distribuiría. Nosotros no estamos todavía en este momento examinando el riesgo que pudiera darse con esta vacuna, sino viendo los planes que pudiéramos implementar en caso de ser adecuada. Tarde o temprano, alguna vacuna va a ser aprobada y se va a determinar que es una vacuna segura. Pero en estos momentos no tenemos información sobre ni la seguridad ni la eficacia de esta vacuna si la hubiera. Esa es la respuesta. Y la siguiente pregunta es, ¿cómo funcionaría la diseminación de esta vacuna si hay pruebas previas o si se va a utilizar el uso de emergencias y si la ciudad va a distribuirlas? ¿Y cómo se haría primeramente? Y la respuesta es, Dr. Farley.
with any medicine or any medical intervention, there's always a balance of the risk versus the potential protection or the value of that. And so the question may less be, is this vaccine safe for everybody rather than for what populations might this vaccine be appropriate? And I can't predict what that would be now. I simply say that we will evaluate the data available to us when and if a vaccine is licensed for use in Philadelphia and make our recommendations to people based upon the evaluation we have at that time.
Just a quick follow-up on that. Do you feel that a vaccine has to go through those phase 3 trials and complete them, or would you be okay with an emergency use authorization from the CDC or from the federal government?
I'll let Armando translate first.
The answer to the previous question is cualquier medicina tiene que examinarse en un balance de su eficacia y el riesgo que nos ofrezca, para proteger a las personas que estén bajo riesgo y ver el valor de estas dos medidas. Ninguna vacuna en este momento va a ser segura para todo el mundo, sino tenemos que ver para qué población pudiera darse y para qué población pudiera ser segura. Y en estos momentos nosotros no podemos predecir la eficacia, sino evaluar los datos según nos van llegando y luego decidiremos. La siguiente pregunta fue si esa vacuna, para poder ser distribuida, tiene que completar la evaluación de la fase 3 o si se va a dar por una autorización de emergencia. Y la respuesta del comisionado Farley es la siguiente. Go ahead, Dr. Farley.
So if we're talking about the general population, everybody, I would want to see phase 3 trials and proof of safety and efficacy before we recommend the vaccine. That doesn't mean, though, that there might be some populations for whom a vaccine is appropriate, even if we're before the phase 3 trials, the people who are at extraordinarily high risk, and if the earlier trials do suggest safety.
Thank you very much, and I appreciate the Spanish as well. Thank you.
And we'll let Armando translate Dr. Farley's answer.
Estamos hablando de que una vacuna tiene que comprobar su seguridad y su eficacia, y lo que vamos a ver es si esta vacuna pudiera ser adecuada para la población en general o para la población que está en altísimo riesgo, y si se diera así, entonces se pudiera implementar con ellos, pero no con la población en general hasta no saberlo, si que es eficaz y segura. Muchas gracias.
All right, thank you. I did cut off Layla Jones of Billy Penn before her last question. Layla, you're up.
Thank you. I had another question for Dr. Farley. Dr. Farley, you had said that most of the cases at Temple University appear to be coming from off-campus residents, but Temple, the dashboard that they have lists that 211 of those cases are on campus and only one of them is off campus. So do you know why there's that discrepancy?
I do, because I asked about that earlier. That classification on their website is based upon whether a student has ever swiped into any on-campus site at all. And so students who live off campus, they come on campus for classes or other activities. And so they're classified as on campus in that statistic, but they're residing off campus, and that's where the spread is occurring.
Okay, thank you.
All right, thank you, Layla. Let's go now to Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, just following up on the questions about the vaccine, are you worried that there might be corner cutting at the federal level for political purposes, given that they're specifically talking about election day as a time when it might be available by?
I am concerned about that, and all I can say is that I will evaluate the data that's available when and if a vaccine is authorized for use, and make the recommendations based upon my assessment and speaking to experts around the country as well.
Thanks. Sorry, are the rules for round one here that we can ask about the landlord-tenant court issue?
Yes, yeah, it's fine. Go ahead.
Okay, great. Well, basically, we're just trying to get, we're trying to get a double check on what exactly are the current status of the operations now. It seems like there's some confusion with the protesters. Are some hearings being continued, or is everything just open?
Eva, do you have an update from the courts on that?
I'll give as much information as I have. Joe may have more. The court was resuming hearings, but in a very limited fashion as of yesterday. And the new federal moratorium, the one imposed by the CDC, does not go into effect until tomorrow. So absent other information, they may likely have held hearings today on the 2nd and today on the 3rd, although again, I can't confirm that. I do understand that they will not be accepting new cases that are filed. And I'll see if Joe has any more information.
Thanks. And could Eva, either you or the mayor, could you discuss the administration's position on how you guys think it should proceed?
I don't understand the full question.
Just
What should be?
The protesters are calling for a halt to this. Do you and I know there's things that are beyond your control, but I was wondering if you could comment on the protesters' demands and whether things should.
Well, I don't think we should be evicting people in the middle of a pandemic. I mean, it's clearly what we're all trying to keep people sheltered, have less homelessness, and keep people safe until this plague moves beyond us. So yeah, we want to keep as many people in shelter, in their apartments, in their houses as possible. We want to make sure there's a process ongoing of mediation and discussion with the landlord so they will ultimately get paid. But we're trying to balance everything in the middle of a crisis.
That's all I have. Thanks very much.
Thank you, Sean. Let's go now to Manny Smith of CBS 3.
Thanks. Hi, Mike. Nice to hear you back on the call. Wanted to start with Dr. Farley and the CDC vaccination guidance. I know you guys are just considering planning for right now. But in that case, like, have you guys had some initial thoughts about distribution, where it would occur, where it might occur? Would that be a city thing? Might you use Leah Center again? Those thoughts initially.
As I said before, I mean, it'll depend on what would be the high priority populations that we are recommending the vaccine for. But we have experience in distributing vaccines in other ways, and it would probably be through a combination of sites, such as hospitals and federally qualified health centers, and maybe some new clinics are set up, maybe some doctors' offices, to give people, so we reach people who are high priority and give them a few options.
Thank you. Second question is for Mayor Kenney and Managing Director Alexander. Speaking of the CDC order that on evictions, you guys are probably hearing a group of people outside who are interpreting the order a little bit differently and want courts closed immediately. We are hearing there might be some arrests and some other things going on. Can I have an update on what's happening?
I'm not sure exactly what happened unless Tumar's got some new information. But we appreciate people's right to protest and express their First Amendment right. Again, as long as loud as they want. Blocking a courtroom door, blocking a courtroom from people getting in or getting out is something that's not part of your First Amendment rights. And we have to make sure that that our institutions can do their business while at the same time people expressing their concern or upsetment with any particular policy.
Good afternoon, Manny. There was a total of 17 arrests. Most of the folks will be processed off-site and issued a CBN for failure to disperse. That's the latest. That's actually the latest numbers I got so far.
Okay, no problem. Thank you very much. And in reaction to that, we heard initially that there might be a number of protests this weekend or even Friday. Is there in here that there might be a mobilization of police in response? Is that something you guys can confirm or discuss at this time?
Kurt, we were aware of, I think, one that's been talked about on social media, and I think we've had experienced them before, and they're peaceful protesters who express their views. I believe it might be at Dilworth Park or somewhere in that vicinity. We mobilize police to make sure that people are safe and to make sure that the facilitation of people's First Amendment expression is done in a safe manner, and the traffic is out of their way, and everybody stays safe, expresses themselves, and has a.
All right, thank you very much.
Thank you, Manny. Let's go to Kelly Rule of Fox 29.
Hi there. I just wanted to clarify on the Temple. What role did the city play in Temple going to all online classes? Was there pressure from the city to do this? And again, just, your reaction on their decision to do so.
Let me start first. There was no pressure from the city. When we deal with our partners, it's information sharing, it's data sharing, and the institution itself makes a decision based on the information we're giving them. So the term pressure on Temple is not accurate, and it's was done mutually understanding the information, and they made the right decision. Doc?
I was going to say the same thing. We work closely through
Getting
Temple.
smarter, Doc.
Again, from the summer right through this outbreak and all this discussion through this of what the appropriate response. So with not pressure, it came through a decision for Temple. We do think it's the wisest move at this point.
Great. I have other questions, but I'll save them for the next round. Thank you.
All right. Thank you, Kelly. Let's go to Martin Pratt of Philly YBN.
Yes. This question is for about evictions. On Tuesday, there was mention that the landlord has to bring the eviction papers forward. If tenants aren't able to do that, how do tenants protect themselves when a landlord does something like just put their stuff on the sidewalk, which is what people are really concerned about, without going to the court? And is there a recourse for the tenants when they themselves are saying, look, my landlord's evicting me, but he or she hasn't filed paperwork?
Thank you. Eva or Joe, did you guys want to tackle that?
This is Eva. I'll start. If a tenant is being informally or illegally evicted, in other words, they had no notice, they can certainly call 911. They can also file a complaint with the Fair Housing Commission. And there's also a tenant hotline at 267-443-2500. Joe might want to add more.
No, that is it. You've covered it, Eva.
Okay, so one question, Deputy Managing Director.
Manny, I think you're frozen there. I'm not hearing you.
Martin. It's Martin.
Yeah, I'm sorry, Martin, excuse me. All right.
Hello? Can you hear me? Yep, can you hear me?
All right, go for it. Yeah, it's choppy, but go ahead.
Okay, sorry. The tenant cannot bring forth a action. They have to respond only. And when they respond, can they ask for mediation, or is that something different?
I think the best way for a tenant who wants to be proactive or bring an action is through the city's Fair Housing Commission, and they can do that. And so we would recommend they go to their website or call their phone number.
Okay, thank you.
Thank you, Martin. And finally, in the first round, we'll close off with Shira Arias of Telemundo.
Hi, Mike. I have a question about crime. So is that something we want to leave for the second round, or can I ask it now? And
Well, let's call this the second round. There are no other hands raised. So we will now go to a second round for other topics. And why don't you go ahead, Shira?
Perfect. Thank you so much, Mike. Okay, Armando, tengo una pregunta para el alcalde, para la ciudad en general. ¿Qué actualización hay con el plan de la policía contra el crimen en Filadelfia y qué piensa él que se puede reforzar para que esto disminuya?
My question is for the mayor and in general for the city. What is the update in terms of the plan that the police has to deal with crime in the city? And is there anything that you would want to do in terms of reinforcing it?
Well, obviously, we've been working on our crime and violence reduction plan. Our police commissioner and leadership are implementing that plan along with our folks from the managing director's office that are involved in implementation, and along with our community partners. Like I said on Tuesday, one of the big problems is this COVID situation has made us all remote, and remote from each other and remote from the young people who are in danger of being shot or being a shooter. And as you see, as I saw yesterday on national news, there were, I think, 30 cities across the country that are experiencing an uptick in homicide and shootings anywhere from 20 to 50%. And this seems to be a kind of a national epidemic on top of the pandemic. And we're going to continue to push forward our plans to do the best we can as things loosen up to get with our young people and to get them in the right direction.
Obviamente, nosotros estamos trabajando con el plan de reducción de la violencia y el crimen en la ciudad, con la oficina del comisionado de la ciudad, la oficina de administración de la municipalidad y con nuestros socios comunitarios. Pero como se anunció el día martes, debido a los problemas que ha impuesto la pandemia del COVID-19 para las reuniones, ha afectado a todos para poder reunirse, pero también a la gente joven a quien estamos tratando de contactar, ya sean como potenciales víctimas o como potenciales delincuentes que estén haciendo esto. Y como se ha indicado en los informes nacionales, hay más de 30 ciudades en las cuales ha habido un aumento en la violencia, tanto en los tiroteos como en los asesinatos, que va del 20 al 50%. Este es un problema nacional y es una epidemia nacional que se ha empeorado en vista de la pandemia. Así que nosotros tenemos un plan y esperamos tener las condiciones para poder implementarlo y continuar con ello. Gracias.
And let me just add further and remind folks that Philadelphia Police Department, through a lot of hard work, they've taken 488 guns off the street last month, and hundreds of guns each month preceding that. And we have to understand that that's major part of the problem is access to those weapons. And we need help from Congress and from the Pennsylvania legislature to eliminate the number of weapons that are available to anybody.
Y quiere agregar el alcalde un recordatorio para todos de que la policía está trabajando arduamente con este problema y que se han retirado 488 armas de fuego el último mes y en los últimos meses cientos de ellas cada mes. Esto es parte principal del problema, el acceso a las armas de una forma ilícita. Y estamos trabajando con el Congreso y también con la legislación de Pensilvania para tratar de enfrentar este aspecto de ese gran problema. Gracias.
And just to be clear, Mayor Jim Kenney, it was 488 months in one entire month?
One
Or-
entire month.
Okay, okay,
488 armas en un mes completo.
okay, perfect, last month. Okay, thank you so much.
Muchas
Thank you,
gracias.
Shira.
Thank you.
And let's go now to Pat Loeb of KYW. Pat? Pat, we're not hearing you.
Sorry, can you hear me now?
Yep. You
Okay.
got it.
I wanted to ask the mayor about boom cars. I understand 4 South Jersey mayors wrote to you about this, and I wondered, is this a chronic problem police have been dealing with, and what really is your capacity to control that?
Can you define boom cars? Because
Well, it was in the letter from the 4 mayors that,
I haven't seen that. It's probably in the managing director's office somewhere.
oh, okay.
Have you seen?
Yeah, and they also posted your response.
Oh, okay. Well, look, there's a lot going on, and I appreciate concern coming from other jurisdictions, and I appreciate the issues that we have to deal with here in the city. And it's no disrespect to them, but it got handled on a different level. And if two more you have, for anybody has any information on that.
Yeah, Pat, I know I didn't see the response myself, but I know PPD has been working to increase enforcement. This is something we typically see sort of every summer as the weather gets warmer. We typically see that. So police have been enforcing. I know we responded to the South Jersey mayors, but this is an issue that crops up
Is this
every year around this time.
Are these drag cars or are this cars playing music?
Cars play music, yeah.
Oh, cars playing music, all right. And it's, even with the people who are drag racing, I mean, a lot of these cars aren't necessarily Philadelphians. There are lots of Philadelphians, but there are also people who come from around the region and the various counties, and possibly even from New Jersey, that congregate and do this kind of stuff that annoys people.
Okay, thank you.
Mike Dunn, you are muted.
Thank you, Kelly. Let's go back to Manny Smith of CBS 3.
Yesterday, one of our reporters, Trang Do, did a pretty extensive story. We got a lot of questions from neighbors regarding ATVs, motorcycles, and bicycles that have pretty much been menacing certain parts of the city. There's one coalition of Center City neighbors asking for 4 things: more enforcement, additional street engineering solutions, rumble strips, some community intervention, for police kind of checking social media to kind of stop those rides in advance, and a designated alternative space to ride. We could not get any response from city administration or the police department on that today. Neighbors are really, really frustrated. Is there anything that we can say in response to that story today about initiatives and planning, or just your thoughts, or maybe you'll be revisiting these discussions and concerns?
It's been an increasing problem, and I think the pandemic has contributed to people being bored and doing things they should be doing. It is a dangerous situation. The off-road vehicles are not legal, are not street legal for Philadelphia or any place that's not off-road. We have been monitoring social media to find out where these vehicles are stored. My understanding is they're stored in large amounts, and also tracking social media on what's called ride outs, where they plan to get together to go to a certain place. One of the issues that we face when it comes to intercepting them or interdicting them is that it's like a high-speed chase. When the vehicles are moving at a high rate of speed, an officer in a car trying to stop that creates difficulties and danger for the rider, the officer, and those on the street. And while I realize the ATVs cause danger for those on the street, it's an awkward problem for us to try to find out a strategy to deal with it. But we're dealing with it, and we're trying to I think we've, tomorrow, I don't know if you know, I think we've had a couple operations where there were a large number of bikes that were confiscated.
There was an operation I know last night in South Broad Street.
Oh, okay.
I'm not sure of the exact numbers, but we could get back to you, or have PPD get back to you with that.
Just put it this way, we're aware of it. We understand the upsetment. I'm upset about it too. I don't like to see it or hear it either, but we got to figure out a way to safely deal with it.
All right, no problem. Thanks so much. If you guys have an update on that South Broad thing, we can update some reporting this afternoon if you can get back to us with some numbers.
Okay.
Thank you. And earlier, David Melandra of Philly Sports Network was unable to connect due to issues on his end. Dr. Farley, he has emailed his question to you, so I'm going to read it. He says Governor Wolf announced yesterday new guidance for sports in Pennsylvania. Attendance for outdoor activities is 250 or less, and indoors is 25 or less. And David was looking for your thoughts on that revised guidance.
So across the state, the limit for outdoor events of any type is 250, but here in Philadelphia, we've kept it at 50. Concerned about larger size events than that. The only change is that the spectators were specifically prohibited at sports events across the rest of the state, even though people could gather in other settings, but not be a spectator at a sports event. So it's a fairly small change across the rest of the state, and it wouldn't be consistent with what our current restriction here is of 50 people total for a limit of an outdoor gathering.
Thank you, Dr. Farley, and seeing no further questions, that brings this briefing to a close. We will resume next week on Tuesday after Labor Day. Thank you.